Well, welcome. Good morning. Thank you for joining us today. It's going to be a great presentation. I know about United that we care, right? And so the steering committee, when we were planning this, we thought it was important that as nonprofit professionals, that we're used to being the ones that provide all the care, that we're always the one with the answers. We're always the one that listens, to people's problems. But sometimes, or many times, it's hard to process that. And then we care for others, but who cares for us? And if we're not there, if we don't take care of ourselves and our own care, then you can't take care of others. So today we're going to hear from Twila about best practices for our own personal care. And we're excited. Thank you, Twila. It's good to see you.
Hi.
So it's always a little awkward doing introductions, self-introductions during the Zoom world. But what I've done is wrote down the names of all the participants, and I'm going to call on you. And if you'll just say your name, of course, and what agency or who you serve, then, and if I have missed you, I apologize for that in the end, and you just need to speak up and let me know. So I'll start myself, Sharon Prue. I'm the Executive Director of Hope Village. And then we have our host people today from the Chamber. Who do we have from the Chamber?
Hey, Sharon.
You going to go first? Yes.
I did.
Sherry.
Yeah. Hey, Sharon. Sherry Sweeney, Vice President here at the Chamber. Great to see you guys in Twila. We so all need this. So thank goodness we're going to get it right now. And then we record it and Montea gets it out to the membership because it couldn't be more important. So thank you.
Julia.
Hello. Good morning. Julia Gallagher. I am with NRM Mortgage in Seabrook. And on the nonprofit end, I work with Rotary Club and Bay Area Chorus of Greater Houston.
Welcome. And Twila.
Oh, I have to go already? I thought. I'm Twila Lindblade with Oceans Behavior Hospital. You'll hear more from me later.
Yes. Hillary.
Hey, good morning, everyone. I finally got some coffee in me so I can wake up. I am the Executive Director of Higher Up Texas, serving Dickinson High School and teaching young people how to adult and self-advocate for one another because we can't read their minds.
Jenny.
She might be working on something real quick.
Okay. Jenny with the Chamber. It just says Jenny. Okay. Jenny with the Chamber. Milagros. You're unmuted. Do you want to say hi? Okay. Richard.
Hi, Sharon. Good to see you. Richard Gruen. February of 2018, I retired from Boys and Girls Harbor, now today's Harbor for Children. I was there for 13 years as their Director of Development and Communications. 50-year nonprofit career, all in the Houston area. Do a little consulting now. Really have kind of focused on being a nonprofit volunteer, staying involved with the Chamber in a volunteer role now and trying to help with the events when I can. Good to be with everybody. I also serve on the board of the Association of Fundraising Professionals, Greater Houston chapter. And if any of you would like to become more familiar, just send me your contact information in the chat and I will reach out to you and be happy to talk with you about our Association of Fundraising Professionals.
Nice. Thank you, Richard. I see your backdrop. It looks like you're enjoying retired life a little bit.
You know, whenever I get a chance, and I'm probably busier now than when I work, but I do like to go fishing, and I'm blessed to have some friends that have some ranch property that let me come up and spend a little time getting peace of mind.
Nice.
Nice. Good to see you. Shannon.
Likewise.
Hi, I'm Shannon with The Rose, the breast healthcare nonprofit, and great to see you, everyone. It's always great to see people.
Yes. And Tracy.
Hey guys, I'm Tracy Ariana with Frost Bank, and I work with nonprofits and government entities at Frost, and that's all I do. And so I think I'll have an opportunity to talk in a little bit, so not to waste any time. Next up, Sharon.
Okay. Max.
Hi, good morning, everyone. My name is Max Garcia, and I'm from Community Health Network. We are also a nonprofit organization providing medical, dental, and behavioral health services. So psychiatry, counseling, PD, OB, primary care. We have locations all over Brazoria, Galveston, and one location here in Harris County, right off Scarsdale and Beamer. And right now we are providing our COVID on the go. If any of you or any organizations have possible exposure, we'll go out to your location and test your staff at no cost with our mobile units. So if you're interested, I can put my information down on the in the comment in the chats. But that's it.
Great. It's good to see you. And Melinda?
Hi, good morning, everyone. I'm Melinda Garcia. I'm director over at the United Way of Greater Houston. And so I oversee all our outreach community centers, specifically in Bay Area, representing today, in Fort Bend, Waller, and also in Montgomery County. Mm-hmm.
Wonderful. Welcome.
Thank you.
Is there anybody else? Have we missed anybody? Okay, well, that sounds good. Right now, I would like to give Tracy from Frost Bank a little time to visit with us. And we just want to thank you again. Thank Frost Bank for sponsoring this project, this committee, what we're doing here and supporting us. And it's just been a really great relationship, Tracy. Thank you.
Well, thank you for allowing us the opportunity. What a great group of folks y'all gather every month. And I think it speaks volume to the need and to the topics that y'all are bringing to light. So I always enjoy getting to hear a little bit from each of the speakers, and I apologize that I have to jump off about halfway through. But I guess from a Frost Bank perspective, we're a Texas-based bank, 152 years old. We've been doing it for quite some time. We're a banking, investments, and insurance organization, and we're located in the Clear Lake area for sure. We have several openings or branches. Clear Creek is our newest one, but we have one on Clear Lake City Boulevard, NASA Road, and as you may or may not know, we started out in 2018 with 25 or so branches in Houston, and the goal to double our size and footprint here. And we now are at, by the end of this year, we'll be at 50 branches, 52 branches actually. So it's a statement and a testimony to our commitment to the Houston area. And again, I work solely with nonprofits and government entities. I'd love to be a resource for any of you that might have questions. I know that Hillary and I have followed up on a couple of occasions about things that are going on with her and how we can help. So don't hesitate to reach out. Frost is definitely a community style banking organization, and we want to be involved. The other thing I always like to leave with one aside is you have to ask. It's always no unless you ask. And every one of you here has a goal to raise money to further your mission and the various services you provide. So I know COVID has really made people balance whether or not to ask. From a banker and from people who are seeing it, ask. The only thing they can say is no. And, you know, from a salesperson, you have to get so many no's before you get a yes, right? So, I mean, one more no is on your way to a yes. So don't hesitate to ask. And I wish all of you the best of luck and a great week. And I'll stay on for a little bit. Thanks, Sharon.
Oh, thank you, Tracy. And you know, you bring up a really great point, again, is about the relationships that this community we have here, and the reason we do meet is about also building relationships and working with each other. And Frost Bank has a lot of wonderful opportunities. I heard Max throw something out. Richard has thrown out things. So please, everyone that's here today, take advantage of the resources that we can all do to help each other, that we can help to connect. Okay, well now the starlight is coming up. Our speaker for today. Few housekeeping things is please make sure you're muted, that you keep muted so we don't have any background sound. And feel free to either use the raise your hand or chat feature for questions. But we are going to save the questions till the end. So we're going to go ahead and let Twila complete our program, and then we'll have questions in the end. Does that sound okay with you, Twila? Okay, well,
I'll get this mute button real quick. Sorry, I'm just talking up a storm. I'm okay with waiting until the end for questions, but I'm also an extrovert, so I really just want to have a conversation with everyone today. So yeah, I appreciate the respect, but I absolutely just want to have a conversation mostly. I do have some good information to share, but I want to be able to be interactive and want to talk about what you guys need most specifically.
Well, thank you for that direction. Absolutely. We'll keep an eye on it. And if you see something that needs to be addressed right then, I guess we'll just play it out that way. Does that sound good? Okay. So I get the honor of introducing our speaker today, Twila Lindblade, which I have personally known for many years and have always enjoyed our relationship. She's the community liaison with Oceans Behavior Hospital in Pasadena. The hospital provides inpatient and outpatient psychiatric services for individuals 18 and up. Their specialty is older adults, ages 50 and older, who experience behaviors associated with dementia and other mental health issues. Twila has worked with Oceans since May of 2019 and has enjoyed serving the hospital in a variety of ways. Her favorite part of the job is having an opportunity to connect with patients one-on-one and having an opportunity to improve their quality of life. Prior to working for Oceans, Twila worked for Visiting Angels, the Galveston County Food Bank, and for Congressman Ron Paul, providing various community outreach services. She obtained her bachelor's in communications with a minor in psychology from Sam Houston State University, and is currently obtaining her master's in social work from Our Lady of the Lake University in San Antonio. In her spare time, she enjoys spending time with her 3 children, ages 5, 9, and 12. Please help me give a warm welcome to Twila Lindblade.
I like your shout out, Melinda. Yay, social work. I'm very happy to be here and to be able to see all of your faces. I wish I could give you all a hug because I am a hugger as well. So for all those extroverts, you know what I'm talking about. We like to feel people, touch people, and not only the lives of others, because all of you guys are nonprofit leaders, but it's just something about the energy of other individuals, most especially other nonprofit leaders, that we have a certain connection with. So before I really kind of get started on some best practice tips and a little bit of background, I want to hear from you guys because I haven't been in your meetings recently. Jenny has provided a little bit of input on what your state of mind is. So if you guys would enlighten me, whoever feels comfortable in sharing, I know we're all in a safe space here, just kind of let me know what what are some of the major challenges that you guys are facing right now in the arena of self-care? Anyone want to share?
I'll share. I'm not
okay.
sure.
Thanks, Julia.
Yes. In the arena of self-care, I am incredibly challenged keeping my focus right now. COVID sort of threw things off with the change, and then in my personal life, I've had a lot happening, and in between little ones at home, the return to school has been huge, like savior to sanity. But in between little ones at home and trying to balance everything you see in the news that can just be completely mentally and emotionally overwhelming, to just keeping up with the day-to-day of work and everything else, I've really had to do a little soul searching on my priorities and let some things go and decide what I really want to put that energy into, because that ability to focus is struggling right now.
Absolutely, 100%. I'm sure many of your colleagues here can agree. Anyone else having some balance issues, or you know, just prioritizing, or anything else you want to share?
Not on the balance issue, but just for me, extroverted hugger, lives alone and works from home now. So it's just the lack of that interaction of the people around you that you get used to going in the office every day. I do laugh. I'm quite used to not putting on makeup. That's gotten really, like, every day you look at your schedule, like, do I have to actually get dressed or not? But, you know, and I used to leave the house 5 days a week, and that seems really weird now. But I do miss that interaction with folks. That, you know, Zoom is great, and, you know, our department's trying to focus on keeping us, you know, together. We send out weekly photos of what's happening in our lives, kids going back to school, but it's not the same. I mean, obviously it can't replace what we all had when we were together as a group.
Of course, absolutely.
I'll say it's been interesting that you hear a lot about, oh, okay, so we're social distancing, we're staying at home. Oh, I'm doing this more. I'm watching Netflix. I'm doing this. I'm doing that. I'm doing that. You know, that I haven't done before. And and this is speaking to my own balance. My balance isn't there. It's like I'm working 60 to 70 hours a week because it's more convenient. I've already had 2 Zoom meetings this morning, and the reason I'm able to do that is I don't have that drive time. And the drive time for me had a lot to do with self-care. I mean, because that was a self-talking, going, okay, I'm the chair of the education division. Now I'm moving to this next meeting where I'm the executive director of this organization, and I'm doing this. It's that self-talk and being able to do that. And so I jumped from one thing to the next with a little transition.
Very good point, Peter. Very good. Thank you for sharing. How about you, Hillary? It doesn't look like you're multitasking or anything like that right now, right?
I have a lot of trouble concentrating with the constant interruptions. My 5-year-old is in kindergarten, but she's got issues right now in kindergarten, and a 7-month-old. So it's very difficult to concentrate. And then when they are down, I don't want to be having to open up my computer again, because it's my time to, you know, spend with my husband or whatever, you know. So it's the concentration, like Julia said.
Absolutely. I'm sure we've all seen that meme with a female in a female's inbox, or a male, or it's just any one of us in this arena who has multiple hats that we wear. It's like our computer browser has multiple file folders open at any and all time. So I personally am in the same arena. I know Sharon shared a little bit about my background or whatnot. I'm a single mom of 3 kids, and I'm pursuing my master's and working full time from home. And I get it. It's incredible. It can be incredibly overwhelming. What about the task of delegation? I know that all of us are leaders, and sometimes relinquishing a little bit of that control is tough. So how about delegation? Has that, have you been able to do that a little bit more or less in this season right now? Anyone want to share?
I'll share. I have one staff member and an intern, and it's wonderful. It's made my life a lot easier, and they're happy to assist because, you know, when people say, let me know if you need help, that kind of just, okay, that is at a nicety that we're sharing. But when you give a specific task, hey, I need you to XYZ, got it. You know, it's direct, and that's been my saving grace in this time and being able to get things done, and utilizing my team the best way I can.
Awesome. Thank you. How about you, Melinda?
So delegation's a little tricky one. So while my boss is constantly telling me I need to delegate more, because I'm a little bit of a control freak sometimes. So I have been letting go a little bit because it's just sometimes some days I'm like zoomed to death with 6 to 8 meetings between Teams and Zooms and everything, and just honestly just working longer hours. I'm saving on commuting, but my hours are longer. It's harder to get away from the computer, I guess, you know, at home. But what I would say with the delegation that I have been doing more, it requires a lot of effort up front. So, and especially right now in kind of this remote working kind of era. So I have some individuals that I have to delegate items to. Their computer skills are not probably the best. And so I've had to do a lot of just like basic training, you know, even on Zoom, Zoom and, other online platforms were available to us, but we never used them as frequently, with all the features. And so one thing that I'm thankful for is that our United Way invested in all our staff to have LinkedIn training accounts now that we have access to webinars. And so I've been able to delegate more with also a plan with my staff or team saying, hey, go ahead and go to your LinkedIn training and do these modules on Zoom, or how to utilize Zoom more efficiency, you know what I mean, and different things, because it's the technical skills of some of the team members that I would have to delegate now that had to bring that level up, and they're doing great, but it's just, again, even to delegate, you have to still put time in the front or training and follow up and so forth to be able to delegate eventually. So, but for the younger folks, it's been great because they can pick it up and go. They've been in this world, but for some of us, we have to pick up skills that are just thrown into these platforms that now we have to use and live on. And we just, it's just something that we said we would do eventually, but now we're being kind of forced into it.
Are you guys scheduling in me time? I know that's really the main thing that we're focusing on today, is best practices of self-care. But let's just be honest and be real and transparent with our teammates right now. Are you scheduling in that me time? Are you giving yourself a certain amount of time each day to turn off your phone, to turn off your computer, and to decompress? Are you allotting that time to yourself? Julia, I'm just gonna throw you under the bus.
Mine might be double-edged. So I just started taking kickboxing, and that's something for me time, to stress relief, to get healthier, to feel better. However, to fit it into my schedule, I take it at 5 a.m., which means I get up at 4 a.m. to make it to class, and then I come home and I shower and I get my daughter ready for school and take her. So I'm making time for it, but is that the healthiest to be waking up at 4 in the morning? I'm not sure.
So let me ask you, how many days a week are you doing
it? 3 to 4.
Okay. Did you start like that, or did you just kind of like go full throttle, all in?
No, my goal when I started was to do at least 3 days a week, and I enjoy it. So the 4th day I squeeze in like on a Sunday morning. So the Sunday morning's a little later. That's at 8. That's nice. But in order to fit it in before the work and school day gets going, Monday, Wednesday, Friday, I'm doing 5 a.m.
Does it help you sleep better?
Oh man, by the time I hit the bed, I pass out. Yeah.
Yes, exactly. Okay. Anybody else want to talk about scheduling in self-care? Hillary, I know you're a runner. I'm just going to throw you under the bus again.
Yeah, I'm pushing a baby stroller this time, so that's a little harder, but I do have a partner that I'm training to run a half marathon. So it's really nice to have someone that I don't know super well, but we have this special time together every Saturday. It's scheduled, and then during the week, you've got to train also. So that's been my time. And of course, anytime I can sneak away and run an errand kid-free, I like that.
Silence. How about you, Shannon? Do you schedule me time?
A little easier for me because I don't have kids. So is it productive me time? No, because it just, not leaving the house, and it doesn't mean I get anything done either, just, plans to go to the gym now that I feel safer, and I know the gym's got precautions in place. So that's on the list of things to do that would get me back to feeling good about that and spending that time focused on music. Like I said, you're working from home. It's easy just to go do one quick thing, if I'm just not doing anything else, like go run to the office and do something at 8 o'clock at night, because the office is next door to the living room anyway. So I can just run in there and do stuff. So trying to do that less and less. It's not expected of me by any means. It's not our culture at all. It's just nothing else to do. So why not, work on something since I'm in the house, and the office is in the house now.
Yeah. Okay. Anybody else want to share?
Yeah, I've made it a point, even though I'm retired, there's still a need to do something different during the day that's peace of mind. And I used to go into the gym twice a week, and when COVID hit, I quit going into the gym and working out with a personal trainer, and turned around and started just doing a daily walk. And that's now become a daily 7.5 mile walk.
Awesome.
And it's really, I live in an area that's adjacent to the River Oaks area in Houston. And so I've kind of made that my walking space. And it's really interesting when you drive through River Oaks, it's one thing, but when you actually are on your feet and can appreciate the beautiful architecture and the gardens and the landscaping, and I guess the benefit of all of that is that over the last 6 months, I've actually lost 40 pounds. So what the doctors tell you about taking care of yourself and daily exercise, and I've stopped going to restaurants back in March and doing all my own cooking because I enjoy cooking. So there's been kind of a positive uptake. If I can avoid catching the virus, I will come out of this probably a healthier and more grounded person, both physically and mentally.
Thank you so much for sharing that, Richard. I think that that's important to note, that that during this season, we've all sort of taken a step back and are taking a lot of things into perspective. We're used to staying busy, not only with our families, but community involvement with our own organizations. In the mental health field, I know I heard, I believe it was Max talk about this. We are experiencing a lot more substance abuse. We're seeing a lot more suicidal ideations, unfortunately, in all age groups. I know that the media talks a lot about the nursing homes and those individuals that are not able to connect one-on-one with their family members, but the good thing is that they do have staff members and they do have one another that they can still connect with. But we are seeing a lot of isolation issues from every age group. Those elementary school kids who don't have an opportunity to connect with other kids in their own age group. those of us adults that are used to being out into the workforce and are now confined to our homes. If you're an introvert and you don't, necessarily like a lot of people that much, that's cool. I've learned that I'm a little bit more of an introvert than I thought, and that I do like a little bit of peace and quiet from time to time. But we've definitely had an opportunity to learn more about ourselves and to take things into perspective. And each and every one of us in a leadership or nonprofit role, each of you guys are used to, as Sharon said when we first got started, taking care of everyone else. That's part of our role in a nonprofit, whether you're a volunteer or a leader, or whatever the case may be. Even chambers of commerce, they are nonprofit organizations. So you're used to helping take care of your patients, your clients, your families, and your employees and their families. But sometimes you have to take a step back and look at yourself. I describe it sort of like a bodybuilder. Okay, how does a bodybuilder get strong? A bodybuilder has to build their muscle, build their endurance, and they have to be mindful of everything that they are ingesting. They have to be mindful of their nutrition. They have to be mindful of the weights that they are strengthening their bodies with. Everything that they are intaking mentally. So if you want to be a strong anchor for your family and for your team members and their families, then you have to make sure that you are strong and balanced. It's very hard to do that, but you have to remember to make this a daily practice. I think in the beginning of this, we thought it was going to be, hey, we can do this for 6 weeks, not a big deal. 6 weeks turned into 6 months. So it's becoming, I hate this term, a bit of the new norm. But each and every day we have to make a point to make ourselves a priority. Okay. Again, if you can't take care of yourself, you can't take care of anyone else. That's in any relationship, whether it be an employee and an employer, a client and a nonprofit agency, or a parent and child relationship. So this is all encompassing. So strengthen that foundation. You guys may have read some of these tips online. So I've done a lot of different research, and first and foremost, be mindful that this pandemic is a type of trauma. Okay, let's be honest and real. And trauma can affect the brain in a multitude of ways. And this is a type of trauma that's ongoing. Okay, because it's changing the course of our lives. Okay, if you have been in a war, if you have had any type of major crisis in your life, even a hurricane, and having to evacuate, and just remembering that trauma and how it affected and impacted your life, that's what we're dealing with right now is a trauma in terms. And so sometimes when you're dealing with the trauma, it can change the chemical makeup of your brain. It can make changes in your brain, and your brain goes to that fight or flight response. It's just the way that the mind works. And so what happens is, if your mind is at that constant fight or flight stage, it's going to go into shutdown mode, and it's going to change things. And we're going to use unhealthy coping mechanisms because we don't want our brain to be there anymore. So if we don't want our brain to get to that point, we've got to be mindful of what we're ingesting, be mindful of what behaviors that we're allowing ourselves to do, and be mindful of what interactions of other people that we are also allowing. So if in the past, let's say, for example, right now, you guys have a lot more control over your own environment than you may have been able to do in the past. So let's take the media, for example, okay, and news exposure. News exposure is something that we're not going to get around. When you turn on the radio, you're going to hear something. When you turn on the television, you're going to hear something, and everybody's going to have an opinion about it. Everybody's going to have an opinion about the pandemic, and they're going to use all sorts of scare tactics, you know, and everybody has a different theory. Is it the government? Is it a conspiracy? Are the numbers overrated? Who knows? Okay. That's not something that we need to focus on. So number one point I want to stress about self-care is to be mindful of what information that you are ingesting. Okay. Don't turn on the TV all day, every day. Don't read the internet news just because your boss is not in the room and you can. It's not going to help your own mental health by reading all of this negative information. Yes, the news is important. Yes, it's important to be mindful of what world events are going on, but be mindful of how much that you consume. And also be mindful that the internet and the mainstream news media are not always 100% accurate. So you have to take all of that with a grain of salt. Another thing is that chronic news exposure can intensify the trauma. It can intensify, again, that fight or flight response in the brain. And that's not something that we want to stay alert in our minds. Another thing that we need to be mindful of is that all of these feelings are normal. Fear, anxiety, some anger and some sadness and some overwhelming. Just know that it doesn't matter whether you've ever faced any type of anxiety in your life or not. The times that we're experiencing right now are 100% normal. So it's normal to experience these things. So don't beat yourself up and think that there's something wrong with you. Don't think that, you know, you've got to start taking medication and that's, take a deep breath and know it's going to be okay. That this is normal. It's okay. And we have to connect with other people in order to help cope with this. I know that we're not able to always connect one-on-one with individuals, and we're not able to give those hugs to one another. But if you have a family member in your house, if you have a close friend that you can connect with lunch, do it, because the chemicals that are released in giving a person a hug, for example, is just like an antidepressant. So I know that the media and everyone is telling you to stay 6 feet away from everyone, but let's be real. A hug is amazing. Okay, so don't discount yourself those wonderful pleasures. Okay, give your family members a hug each and every day. And if you don't have a family living in your personal space, then you call that best friend and you call her to come over and have dinner with you and just give each other a hug, because that it has amazing health benefits. Another thing is to stay focused. You're going to have a lot of pressure to stay productive. Like Peter mentioned, you have a lot more time on your hands. You don't have travel time. Your computer is right there right there in front of you. I have 3 computers in front of me right now. One is for this, one is for that, one is for that. That doesn't mean that we have to be on them 24/7. It doesn't. You have to make a schedule for yourself and stick to that schedule. If getting up at 5 a.m. is important to you and your health, and you are noticing benefits physically and mentally, getting up at 5 a.m. isn't anything when you look at the balance that it creates in your life. Okay, so stay focused on whatever your task is for that particular day. It's easy for us as leaders to look so far into the future, like, 6 months. I know I'm supposed to be doing this strategic plan, and in my strategic plan, this was not there. I don't know I'm going to do about funders. Focus on what you can control right here and right now. Focus on a 3-month window. Okay. What can you do in this 3-month window? Plan out that calendar for the 3-month window. If you can't do 3 months, do a week. If you can't do a week, do a day. Start small and schedule 8 days of product or 8 hours of productivity. And when you have that downtime, make sure that you're doing something constructive with that downtime that's going to be beneficial to your health and not detrimental. If you're used to scrolling on social media for 3 hours a day and you're not getting any exercise or going outside or seeing another human, that could be affecting you. Okay, so just be mindful of those things. Another thing is to not overthink. And I know that sounds simple, but watching the media and reading and scrolling on social media, or just trying to process all of the information, especially in the beginning. I know that a lot of us were worried about our loved ones being impacted by COVID, our children being impacted by COVID. I'm not saying that those things are not going to happen. I'm not saying that at all, but don't overthink and get yourself into such a frenzy that you're overreacting. Melinda brought up a good point about how the 9/11 Trump, terrorist attacks being over and over on the news media. Same thing with Hurricanes Katrina and Ike and Harvey. When the exposure is in your face 24/7, how can you not overthink about all of the events that could potentially happen? So try to be mindful of that. I talked a little bit earlier about limiting toxic behaviors in people. We have a little bit more time on our hands, and so sometimes it might be human nature to, well, I'm just going to unwind with a glass of wine. Well, 1 turns into 2, turns into 3, turns into 4, whatever the case may be, whatever your vice is. No judgment here, but alcohol is a depressant. It can be great, in small doses, but when you're starting to use it as a coping mechanism, then it can be very detrimental to your health, physically, mentally, all of the above. It triggers, again, other chemicals in your brain and releases these emotions that are again starting to overwhelm you even more than you already were, and getting into that overthinking. So if you're going to consume alcohol or whatever your vice may be, just be mindful to not be using that as a coping mechanism, because you really need to be focusing on your own health in a healthy manner. So we talked a little bit earlier about self-care, and some of you guys had mentioned exercising, kickboxing, running, walking. I know that Peter is a musician, and so I'm sure that he is playing his instruments a little bit more now, or I hope. These are all great things that we can do to provide a little bit of self-care. How about yoga? Has anyone tried yoga? Yeah, Julia's saying yeah. Okay. So yoga is incredibly beneficial because it can help us with mindfulness, okay? It's a great practice that will allow us to really focus on the here and now and on our mind, and not so much sorry, I'm just reading messages while I'm talking. And it's not so much of a cardio intense type activity, but it is incredibly beneficial for the mind and getting your body to be able to decompress. Are there any other activities that you guys are involved in, or that you are practicing on a regular basis that helps with self-care?
So the program participants in Higher Up Texas, they're teenagers. They're 17, 18, 19 years old. and they are living the life of a virtual reality. And one of the exercises we had them do was take a filtered picture, take an unfiltered picture, write a status that is filtered, like what you want the world to perceive about you, and then write a realistic one. And by doing that exercise, we're teaching them that, you know, social media can make you feel really bad looking at what other people are doing. And they look better, they have more, they're doing fun things, whatever the case may be. But I think it's a good exercise for all of us to kind of take a step back and taking social media with a grain of salt, because it, you know, some people will post negative things constantly, and that's just, that's their thing. But a lot of it is filtered. We're just seeing the highlight reel. So in thinking about mindfulness, that's really important for us, that we're not sabotaging ourselves because of what we think everybody else has, when in reality, it's a filtered reality.
100%. I absolutely agree. So I know that we're kind of getting to the point where we have to wrap up soon, but I collected a lot of different resources for you guys, and I'm going to share those with Montea. And some of them are, there's some mental health helplines specifically for healthcare workers. You guys in the nonprofit industry, you have to take care of yourselves. So just know that there are some helplines that are 100% free through the state of Texas. I just want to squeeze her cheeks. Anyway, and I'm also going to send a list of resources for substance abuse counseling, not necessarily for you guys, but I'm sure that you guys are helping so many different clients who are going down that path. And not to say that they need inpatient substance abuse treatment or anything of that nature, but there are outpatient resources, group supports, Alcoholics Anonymous. There's so many people that they're relapsing, you know, because that's we're in a crisis right now. We're in a traumatic time. So I'm going to send you guys a ton of resources. Read it at your own leisure. Share it with your team members if you'd like. But whatever you do, please just know that I'm here. I would love to be an ear for you if you just need to vent. I'm not a licensed therapist, so I should put that out there. But I'm in training to be. Anyway, just reach out to friends and family, and don't be afraid to extend that arm and say to someone, I just need someone to talk to. I have some resources that talk specifically about how to start that conversation. It could be a loved one that, you know, you're just not hearing from. You can tell that their behaviors are changing quite a bit, and that this isolation is affecting them. Whether it be you or someone that you love and care about, please don't hesitate to reach out, because we are seeing in this country, there's such an influx of people that may not have ever experienced depression or anxiety in their life, but this major change in our life is causing a lot of those issues to come up. It doesn't mean that it's long-term, that there's anything wrong with you. We are a product of nature and nurture. And so right now in our environment, there's a lot going on, and it's kind of putting our minds in this very uneasy stage. So just know that that you are in great support in this community, and that there are a ton of resources that we want to provide to you so that you can be the anchor for your families and your team members' families and your clients' families. So just stay strong.
Thank you, Twila. Wow. I know I said it earlier, but again, this just shows just in the chat box, the resources you're going to share, is that this group coming together is so much more than the programs and what we're doing. It's about us all sharing and you know, sharing information with each other to help each other, because we all need to, like I said, help each other, because we're always caring for others. And so, you know, we need to be able to take a step back. And all the suggestions that everyone gave in ways that you're self-caring is awesome. And there are things we know, you know, exercise is good for you. We know a healthy diet's good for you, but you know, we get caught up in what's going on in the world. And I think that today was a refresh. Today was a great reminder to bring it front of mind that, hey, these are things that I need to tend to, you know, take care of myself. So Twila, again, thank you. Those resources are going to be wonderful. I think, so not just for us, but to share with our employees, volunteers, everyone else that we come in contact with. So I thank you very much.
Thank you so much for having me.
Yeah. So I'm going to turn it over. I think I have Jenny is going to do chamber announcements. Is it still Jenny or Montea?
Well, I can get started and then I'm going to do some calling outs. So if you as a nonprofit have an event that's coming up that you would like the other nonprofits in this one group to know about, send that information my way. We have a follow-up email that we like to send out after presentations. And so we want to be able to put that information below. So just your other nonprofit friends and family can learn about that. So send any events that you might have coming up to me. Then we can make sure we can get them in that email, kind of get that community calendar started for this group. A couple events that we have coming up. I'm looking at my calendar and then I skipped a bunch of weeks. So tomorrow is going to be our new member orientation. It's going to be virtual. We're extremely excited about it. It's going to be at 8:30 a.m. This afternoon, myself or Jenny is going to be sending out the login information for that. So if you are one of our newer members, and basically we're saying anybody who's joined in the year 2020 because everything got weird really quickly in the year. So if you have not had that time to interact with us on that, we would love to have you join us. You can just reach out to me in the chat or email or give us a call and say, hey, I'd like to be a part of that, and we'll send it to you. If you are one of our seasoned members and you'd like to be a part of just the testimony for the chamber, please reach out to myself or Jenny as well, and we'd love to give you the information so you at least can be a part of the group with us too, because I know new members like to see members who have been involved for a while and hearing those testimonies. So that's really important too. So just reach out to me for that. Next week, I don't know if Sherry's on here, but next week on the 21st, we have our golf tournament. Sherry, I don't know if you want to share any details about that. Well, it's happening on the 21st. So it'll be at Bay Oaks Country Club. We're extremely excited about it, as if you've been here a while, you know that it's normally in March. So we're thrilled that even though we had to push it off, it's happening. We're extremely excited about that. So if you are a volunteer, if you are on a team, if you are a sponsor and you have any questions, Sherry is sending out information, as well as you can just reach out to the chamber and, you know, ask any questions directly. And then next week on the 25th is going to be our bi-weekly coffee break catch-up. So if you are interested in doing that, you can go and register for it on our calendar, or you can just send me an email. I'll make sure I get you the Zoom information. It's just a quick half hour. It's where we are able to do a quick little networking session with all of our chamber friends and families. It doesn't take up too much of your day, but it's a constant networking interaction. And it's great because we put people in small groups, so you can have some great conversation, and the groups aren't too big, but they're also not too small. And then, of course, the 30th is going to be our virtual general membership luncheon. We were able to reschedule Dana Steele to come and speak with us. We're very excited to have her. So if you registered in August, we will move your tickets to September, since we weren't able to have August. But if you are wanting to register, reach out to me, reach out to Sherry. Register on the calendar. That's what I wanted to say. Register on the calendar for that event. We're really excited. And if you, when you register, when you pay for your ticket, you will get a $10 gift card to a local restaurant that is a chamber member. So it's a great way, one, to have a little luncheon with a bunch of great chamber members, and it's a great way to support some of our chamber members with those gift cards. So that's what we have going through the rest of September for the chamber. And with that, Sharon, anything else?
No, I think everything's been covered. And again, Twila, thank you. And thanks everyone for coming today. And we are, look at that, right on the dot, right on time. So everyone think of one thing before you leave this meeting about how you're going to self-care. So we all got to think about it, and then we got to do it.
Thank
So
you,
y'all have a great
Sharon.
Yes. Thank you so much, everyone. Have a wonderful day.
Thank you.
Thank you. Bye.
Bye-bye.
Wow.